What does the research say about brain games apps and digital health? Well, this is where things get a little bit tricky, not because there's an issue, if you would, but because research, in my opinion, in this field is a little bit problematic. So let's talk about examples. So research design. A lot of times the design of the research is very limited, and I get that. It makes sense. You want to try and limit what you're trying to check so that you get a clearer result. You want to make sure that you're actually studying what you think you're studying, what you want to be studying, and you want to limit the confounding factors, and all that is great. But in today's world, it's really hard to do, especially when you're using different digital health systems, because there are a lot of other factors you have to kind of shut out, and it's really hard to do. And many of the studies that I've read refer to the fact that there are other factors that need to be accounted for and maybe confounding the results. Like I said, many of the brain games apps out there target skills, specific skills. But like we know, there's no skill that is that lives in a vacuum. Like, you can't just work on attention. You can't just work on focus. You can't just work on timing. It's really, really difficult because each of them is associated with several networks, and every network is associated with several brain regions. Now, if you have a problem in one specific brain region, then that will affect every network that's associated with it, and that may affect several skills. But if we use skills in a different way, which I'll talk to you about in a bit, then that may change the way that we can study these brain games apps. So again, going back to the question here, when we are targeting specific skills, we're automatically creating, in my opinion, obviously, creating a form of bias in the study. Because, again, we are going to maybe affect the skill that we're checking, but did we affect other skills that we didn't check? Did we maybe make a little bit of a difference in focus, but we made a huge difference in attention, but we never checked for attention? Okay, so in my opinion, that's a downside of most of the research studies that I've read on brain games and video games, etc. Participant selection, that's always a problem in every study, but I think in this particular arena, it's even worse. A lot of the studies are geared towards older individuals, which I don't know how well they utilize this arena, this technology. I work mostly with children, and I give them a brain game, and within seconds they understand the game better than I do. And I've been playing around with it for months. And it's not that I'm stupid. It's not that I don't like technology or video games. It's just that their brains, they are so immersed in this world of technology that they just get it so fast. And so in my opinion, the fact that most of these studies are geared towards older population is maybe, again, hurting or not showing the true potential of what these systems can do. And like I said, or like I implied before, they don't really take into account brain deficits or brain weaknesses considerations. So again, in functional neurology, we don't necessarily talk about pathology. So I'm not talking about lesions as far as dead brain regions or brain trauma or things like that. I'm talking about functional weaknesses, functional dysfunctions, functional disconnections that are associated with different or specific brain regions. And if we don't allow for some sort of assessment of that when we select our participants and when we do our assessments and when we do our post-assessments and when we apply the intervention, then in my opinion, the chances of us getting, again, a confounding factor that has gone unattended